language, so I do have a duct tape coat that Red Green signed and I forgot to pack it, so this will have to do, I suppose. Great to be here. Thank you for having us. Thank you, Glenn and Bright Light News for putting this on. Thank you on a Thursday night to see a packed room. This is amazing. One of my colleagues coined the term, you guys aren't rock stars, you're doc stars. I'm like, oh, that's cute. So to be here at a concert with you is kind of fun. I promise I won't break out into too many songs in the middle of my talk. All right, I have no conflicts of interest, thoughts of my own. We should have dialogue, like Dr. Bridle said. This is about what? An exchange of ideas. If I'm wrong, wonderful, teach me. And what happened to medicine? What happened to the hospitals? What happened to the doctors? And why won't they debate? I mean, Byron brought up that great question. I have nothing to hide. I have everything to learn. And if I'm wrong, great. Teach me so we do better on behalf of whom? The patient, to whom we took that oath. That's what matters. So here we go. Thank you to all the truth tellers, Canadian heroes, your CCA, Canadian Hero Lines. Yes, so much to be proud of here, and so much good information has come out of so many truth tellers that have sacrificed so much as well. So thank you to all of those. Many of you are here. You know who you are. I can't list you all because there's too many of you. So thank all of you as well. Okie dokie, I always start with this one. The man who cannot read has no advantage, or the man who does not read has no advantage over the man who cannot read. Very, very simple thought. Mark Twain. This is the problem we have in medicine, we have in science, we have in society. Everybody is very opinionated, but they're unwilling to read. And in this day and age, it's hard to figure out, as Pierre pointed out, what to read. And so that that's an important question as well. General Patton, if everybody's thinking alike, somebody isn't thinking. So we live in an era now where we have too much groupthink. And where are the critical thinkers? And as Gandhi said, if you stand in your truth and you're the only one, it's still the truth. So don't be afraid to tell the truth and don't be afraid to stand up for it. And of course, all doctors and scientists agree when you censor the ones who don't. It's easy as that. That's what we're living through. And of course, if you can question it, it's science. And if you can't question it, plain and simple, it's propaganda. Easy as that. So if you have a friend or a colleague who says you can't ask that, why not? Why not? Question everything. Always, always question. Does that one speaks for itself? Yeah, we're opening up a little bit down there in terms of our news, and I know Fox is a scary word, and other outlets are as well. And yeah. So here with this riotous crowd, I thought we might as well throw this in. Okay, and we live in a time when people are silenced so that stupid people won't be offended. And I think it's time we end that. Oh yeah, and I think Pierre already hit on this point, so I could go through all sorts of data sets, but I think a picture's worth 1,000 words. So here you have the evolution of medicine and where we are today, unfortunately. And okay, so a little more serious now, I suppose. SARS-CoV-2, spike protein, virus circulates. Now that everything's kind of burned through, we have a bad flu season at best. And, I'm sad for those who lost loved ones. I'm sad that medical systems refuse to do interventions that would have saved lives. And I'm sad that the world was lied to by a bunch of bureaucrats and people in the guise of the word public health that has nothing to do with health. Public health, basically. And then we were tricked into this. Now, I'm not here to judge anybody. If you got one shot, don't get two. If you got two, don't get three. If you got three, don't get four. If you never got one, don't get one. Okay? And I'm going to give you my conclusion first. It's not about the COVID shot alone. The pharmaceutical industries have used a lipid nanoparticle in a gene sequence. You are a human. Your cells are meant to make human proteins. Your cells are not made or meant to make foreign proteins. They push this on the world through all the corrupt connections, Gilly Bates, like Pierre said. But the problem is, they think they have carte blanche to keep doing this with influenza vaccines and RSV vaccines and HIV vaccines and tuberculosis vaccines, you name it. Lipid nanoparticles have two lipids in them, and 40% of the world's lipid nanoparticles are made here in Canada, company Acuitas. There are two lipids in there. If you read the safety data sheet, it says not for human use, for research purposes only, and yet it went into billions of people's arms. How many people knew that? Yeah, that's a good question to ask as well, isn't it? Who owns the Acuitas? I don't know. Yeah, we'll show Fidel Mini later. But anyway, the lipid nanoparticle in and of itself is toxic and dangerous. And then the gene sequence, I'll get to it in my talk, you'll see the purity of these products is absolutely impure. So it's a soup of something that is very difficult to maintain in a laboratory setting, let alone stabilize and ship around the world and put it in the arms of people. It didn't work anyway, as we all know. You look at the Cleveland Clinic study, the more shots you got, the more COVID you got. Period. Plain and simple. That's a preprint. Is it printed yet here? I don't remember. Did they actually finally publish it, or they don't want that out either? So stopping the platform is what's critical. It's not just about stop the COVID shots. Yeah, we need to stop those because they don't work anyway. And yeah, we'll get to it. What did they not do in terms of regulatory research? So a vaccine, traditional vaccine, and you can ask Dr. Bridle about this, there are certain standards that have to be met for a vaccine to be approved. Well, these aren't vaccines. These are gene-based products. They're a biological therapeutic agent. They didn't get tested for safety in pregnancy. Yet how many pregnant women were forced into it? They didn't get tested for mutagenic properties. Do they cause cells to mutate and cause cancer? They didn't get tested for dose dependency because each individual that gets this gene into their cells is going to make a different amount of protein. Why do we see some toxic responses in some people and little to nothing in others? Because we're all biologically and genetically different. And we have no long-term safety on these. There's a reason Moderna had never brought a product safely to market prior to all of this. Never. In 2017, they were worried about going under because they were using their mRNA, Moderna, to try to fix inborn errors of metabolism and gene problems in rare conditions in kids and or for cancer therapeutics. And then Borla, the CEO of Pfizer, says in an interview with the Washington Post, well, gosh, I don't know why we used mRNA. My scientist came to me scientists came to me and said, that's what we're doing. We've only been working on it for 2.5 years at Pfizer. Who had paid the largest criminal fine in American history prior to the opioid settlement. And Janssen, same thing. So we have a company that's never made a safe product pharmaceutically ever, Moderna. And we have Pfizer, one of the biggest criminal companies in history. And we have Janssen that's paid large criminal fines. So we have a syndicate of criminals basically pushing a shot with unproved technology, experimental investigational technology on the world. So it's up to us. A little history lesson. In the US, when we separated from the crown, God bless Oxford and the Queen and everything else, but when we separated, it was 3% of the patriots that said, you know what, we're tired of the tyranny, let's throw some tea in a harbor, declare ourselves free. 3%, that's all it took to stand up. By the time that we won the Revolutionary War, 70% of people were still Tories and loyal to the crown. It doesn't take all of us to push back against tyrannical behavior. It only took 30% for the US to become a new nation. So for us to become a free people, it doesn't take everybody. And I'm not giving too much of a history lesson. I'm just saying, if it doesn't seem right and it doesn't sound right, and you're tired of tyranny, stand up against it. Be vocal. And many of you came up to me and said, oh, thank you for your courage. Well, courage is easy. It's knowing the truth and having your voice to it. It's easy. Especially when you stand in the truth. Oh, yeah, my last slide, I was showing you, okay, so what do they do? I was going to go back to that one, I kind of skipped over this. They took the gene sequence for the spike, wrapped it in a lipid nanoparticles, put some polyethylene glycol around it, put it into a vial. We'll go over the vial contents later if you want to. Put it in your arm, your cells become the factory for the spike protein, not natural. And then your immune response is supposed to make antibodies. I say antibodies, schmantibodies, and everybody knows about antibodies now. And I say antibodies, schmantibodies, because what about your T cell response? What about the broad response of your immune system? So many basic steps of immunology and vaccinology were ignored. Yay, we got antibodies. But those of us in the know with coronavirus knew from day one, the moment they said vaccine, I said, something's wrong. Warp speed, I call it warped greed, because you cannot vaccinate against this family of viruses. There's a reason 40 years later, Fauci doesn't have his holy grail vaccine against HIV, because it always mutates ahead of efforts. And this is a family of viruses, and there's 40 plus species or subspecies of coronavirus in the mammalian kingdom for cows and pigs and dogs and cats, etc., and humans. And we've never had a successful vaccine. Why? Science. They knew this from day one. And so telling a lie over and over and over again never makes it true. But they got away with it. And the CDC changed the definition in the United States of vaccine. Imagine that. We're gonna get away with this because this isn't a war of science. This is a war of words. Orwell was a warning, not a blueprint. And that's the problem we're up against, is we're allowing language and the idiom to be usurped and used in manners that they're tinkering with your neurons in ways that you don't even know they're tinkering with them. And then they pull wool over your eyes and you're like, oh, vaccine, they put the word vaccine on a gene-based injection. Vaccine good. No. And this is where you have to be very acutely astute and question everything. So they changed the definition of vaccine, which was very clever, and just something to stimulate an immune response. Well, great, I'll go lick the dirt then, that's a vaccine. Right? Safe and effective, this was another, no, they're dangerous and defective, and I'm going to show you why. Oh, I can see, clearly, these are safe and effective. And obviously, the speed of sound, the speed of light, and now we have the speed of science. Trust the science. I do trust the science, but coercion is not science. Censorship is not science. Fake data is not science. Manipulating results is not science. Cherry-picking studies is not science. And fear-mongering is not science. All right, so what's a pathologist? I'm a pathologist. Well, who is that? The most important doctor you never meet that you always hope is right. So you never see me, but I get to see a piece of you. So you pee in that cup, we analyze your urine. And we take blood out of your arm, we look at all those results and give them to your doctor. I'm the doctor to the doctor. And my job is to be right 100% of the time so that you get the proper treatment. take a piece of your tissue, a piece of your skin, a piece of your bowel, a piece of your breast, etc. Those go in front of the pathologist's eyeballs. So I look at cells all day long. At least I did until they stole my laboratory through illegal means, but that's another story. And I'm not complaining, because just like Pierre, I would do this all over again, because the truth is the truth no matter what, and the cells don't lie. And one cannot find that for which they do not look. And this has been the trick of the last couple of years. Well, look at this study. Well, and they don't read it. And so we have supposedly a very erudite profession. It used to be a noble profession. But if people don't look, you're not going to find answers. That's the pathologist's job, find the answers. Well, let's see what we've found. All right, first line. Shot just stays in your arm. It's all good, safe and effective. It just stays in your arm. So here's a superimposed needle on a muscle. I'm going to turn you into pathologists in here in 20 minutes. So all those pink strands, that's muscle, and that big oval, it kind of looks like a kiwi bird, doesn't it? That's a vessel. And so you stick a needle in the arm, and you assume that that shot just goes in the muscle, right? Well, what happens to that vessel? It gets shredded and torn apart. How many people have just one blood vessel? No, you have thousands across every square centimeter of your body. And so this vessel gets torn, and these lipid nanoparticles, they were designed to carry chemotherapeutic agents to the brain. They go everywhere. They don't stay in one spot. They weren't designed to stay in one spot. They were designed to go everywhere. So to use a lipid nanoparticle for any shot going forward, you always ask your physician, if you have children or grandchildren, and they're going to get childhood, quote, vaccines, if it is a lipid nanoparticle in the gene sequence, it's a gene therapy, not a vaccine. And that lipid nanoparticle will go everywhere in the human body. So that gets torn. Now in the laboratory, with a lock and a key mechanism, we can use little antibodies and put a color on the tail of them, and they will lock and key to certain proteins. We can design antibodies against multiple proteins. So this is now those little muscles, and they're expressing spike protein. And thank you to my colleague Arne Burkhardt out of Germany. He and I have coordinated, and I've used some of his slides, he's used some of my slides. So this is spike protein in the deltoid muscle of the arm. So great, yeah, look, those muscle cells are making some spike protein after the injection. Great, cool. But that's not the only place they stay. So nothing in the world is more dangerous than sincere ignorance. And scientists have been sincerely ignorant about these basic scientific principles that we knew before we moved forward with any of these things. And that's my big concern, is we cannot have that scientific ignorance. So here is some lung tissue, COVID patient, deceased, unfortunately, and all that coloration you see, that's spike protein. So what else do we see? Well, I can stain that same tissue, and you can see some pink and brown coloration there. Again, these are stains we use in the laboratory. The nucleocapsid is there. What does that mean? Well, the virus is made of a lot of proteins, so I can use lock and key against a bunch of proteins of the virus. This patient had COVID. This patient died of complications of COVID. They had spike protein, they had nucleocapsid protein. We looked at the envelope, a lot of envelope protein. We looked at the membrane, a lot of membrane protein. This patient had the virus. And we can tag all those proteins to the virus. All right, everybody's a basic pathologist now, right? Good. There'll be a quiz later. No, not really. But here's the problem. Here's the other problem. Not only did they use a lipid nanoparticle with dangerous chemicals in it, they substituted. So your nucleic acids, mRNA is slightly different than DNA, and it has a uracil in it. Well, mRNA breaks down. You're making messages right now. You're making collagen, you're making muscle, you're making bone, you're remodeling, you're making proteins for different functions in all the organs in your body. We're making billions of messages right now in this room, all of us. And those little messages, that message lasts for a few minutes to a few hours, depending on how much protein your body needs to make, and then that signal goes away. And your body says, okay, I have enough of it. Feedback loop says, okay, tone down, we're good. When you substitute a pseudo-uridine, a synthetic uridine into mRNA,